All right, we are live.
Good morning, everyone. This is Tuesday, April 14th, Senate Health and Welfare. We have, we will have our own agenda, but we also are having a joint meeting with House Healthcare. So they will be joining us. Let me check the time on that at 11 o'clock when Secretary Smith comes in to talk about an update on H742. And we at 10:30, we have Michelle Childs coming in to give us an update on some issues related to foster care. And we know that's been an important issue, particularly for Senator McCormick, who's been taking that work on with the House as well as here in the Senate. So I asked Nolan to give us a brief update on some of the fiscal issues that are going on. So Nolan, I'm going to turn it over to you. I do want to thank Katie McClin and Jen Carby for being here. We don't always say thank you, but thank you. We appreciate the time that you spend and give to us. So Nolan.
Hi, for the record, Nolan Langwell, the Joint Fiscal Office. I actually just now sent Nellie a link to update that I did the other day, just on hospital providers or healthcare providers. The one thing I just wanted to bring to your attention is on a Friday, we received word that part of the CARES Act, there's $100 billion that's going to go to providers. And the federal government released 30 million of that. It's going to be broken up into two pieces. The first 30 million is sort of like expedited out to providers, and it's based on their Medicare fee for service. The second 70 billion, my understanding, will go out more specific to specific states' COVID-19 needs. So Vermont is to receive $54 million from that first $30 billion. However, it quickly, the stakeholders quickly determined that the 54 million seems a little bit low. And long story short, it was calculated looking at Medicare fee for service, but what it didn't do is take into consideration the all-payer model, where a lot of the fee for services are quote unquote zeroed out. And so as a result, there's a sense that the payment could be between $15 and $30 million short, because HHS did not take into consideration the all-payer model. So the congressional delegation is involved. They're working with AHS and with OneCare, and they're looking at the shadow claims. And my understanding is they're going to be talking with CMS to try to come up with what they think that amount might be. Once that's determined, it's not clear how we can still get the money or not, because the 30 billion was a fixed amount, and that money has already sort of been appropriated. So if it is determined that we're short, it's unclear how the federal government can or will make us whole. So the federal delegate, like I said, Sanders and Leahy's and Welch's office are all involved working on this, but I just wanted to sort of flag this and let folks know that this is in progress, and hopefully it can be fixed relatively quickly.
So when you say providers receiving the initial $30 million, is that hospitals, or does it extend beyond that?
It's 30 billion. Our share is 54 million, and it's all providers that participate in Medicare.
Okay.
So can I?
Senator Westman. So
this is an informal conversation that I had yesterday. They believe it's going to be, it's 54 now, but they believe it's going to be someplace around 70. And what they said to me is 40% of it will go to hospitals, and then 60% to people providing Medicaid services outside of that. The backdrop to that, and it's part of why I bring it up, my hospital is, and I know a number of hospitals now are starting to talk about strategies to cut costs. And they're starting to talk about what that might look like, whether you put people out on furlough that work at hospitals, whether you cut reimbursement in salaries to doctors or people within the community. So, and I think a number of hospitals are talking about all of that because they don't see that money as that's coming through as making them whole. So at some point, we may want to talk about that.
We will. And this is the teeing up of a broader conversation, I would think. And I can almost guarantee that Joint Fiscal Committee will be taking this up. But Nolan, what Senator Westman has said with regard to the additional funds, does this jive with what the advocates and the administration are identifying as the needs that we have in the state, or what's due to us?
What's due to us, I think, is a simpler calculation than what is needed. I think that the federal government put $100 billion to get, but I don't know that, and it's going to go out, but I don't know if it's need based. The other 70 billion may be specific to COVID-19, but it's unclear whether that is going to be enough either. I don't know that those with the need is comports with the amount that's being going out.
I know that in our conversations with various folks when they've been testifying, and in particular with the administration, we've heard about the increased expenses associated with COVID-19 for these businesses. You know, we're talking about businesses now, whether they're DAs or whether they're hospitals or whether individual providers. And then the sense that we want to, that money would be provided, whether through prospective payments or others, and then a true up later on, a reconciliation rate later on. If that reconciliation doesn't jive with expenses, we're still going to see some needs within the medical community. And these are, I just want to say, these are businesses that we can't afford to have fail.
Can I just say two things, and then unless maybe I should let Senator Westman go first. It's your call.
Well,
I'm fine with either one of you going first. Go ahead.
So my question to Nolan: these payments are all based upon Medicaid, correct?
Medicare.
Or Medicare. So it all depends on, in a hospital or in a facility, what your patient base is too.
Yeah, they looked at their 2019 Medicare fee for service rates.
Yeah, but if you're you come from a hospital that does a lot of elective surgeries that aren't Medicare, you get affected differently. So this is really uneven across the board, and so you might have a place that normally, well, you get my point. I think that's something that our committee should look at.
Yeah, that's a great point. And two other things that I would flag is, one is my understanding there's a conversations in the federal level about there being another COVID, I call it COVID 4. Unclear what will happen with that. That may or may not deal with this. The other thing that's happened, and this is in that link that I sent to Nally, hopefully it's been posted. There's also another thing called the Medicare Accelerated and Advanced Payment Program. And this is a program that has existed in the past. It's basically a loan to hospitals. Usually happens in natural disasters and other stuff. There's been only there hasn't been that many in the last 5 years. I think there was like a handful in the last 5 years, and then in 1 week there were 17,000 requests. So Vermont, according to some documents I got, Vermont is going to put out, or Vermont providers are going to receive about 159.2 million in loans to providers, but these do have to, there's no interest loans that have to be paid back in 210 days. So that will help with cash flow, but it's not money, but it's money they will have to give back, unlike the 54 million. So Senator Westman's point is well taken. Hopefully the congressional delegation will work on that in COVID 4. We should probably communicate that to them.
I think it might make sense for us to tee this up on an agenda, and we can talk about who we would like to hear from. We can talk about that tomorrow at our agenda planning meeting. And Senator Westman, if you have some suggestions, I'm happy to have you come in and help us with that.
Thank you.
All right, good. We'll do that. Okay. Anything else for Nolan? it gets a little bit messy. We're in the middle of this emergency trying to cover the expenses associated with it, and then finding out that some of the things that we need are not available, that we need staff, and at the same time talking about changing staffing arrangements and losing people. So it's complex and it is messy and it's concerning. But we'll follow up on this. Nolan, thank you for keeping us informed. And so you sent some information to Nellie that we'll see up on our webpage.
Yeah, hopefully.
Good. Okay. All right. All right. So we're waiting now for any other questions. I shouldn't cut us off at this point. Questions or comments? Senator Cummings, do you think that joint fiscal will be discussing this issue today, or is the discussion more about the recent fiscal update that we've gotten? You're muted. You're muted, Senator.
I'm too good. Today is really just a formative issue. We haven't even gotten permission to vote, so we can't even approve our minutes from the November meeting.
Okay.
So it's really today is just a discussion on what our options are and how we might start thinking about how we're going to handle this 1.24 billion or however much is
Right.
coming, but not any specific issues
Yeah, the 1.25 billion, and apparently,
on the 24th.
yeah, that's yeah, April 24th, and that is the grant that actually I always get a notice of these grants and I have to sign off on them. So it might be helpful for us as a committee to have a conversation about the prior approval criteria for that grant. So we can talk. I've talked with Senator Kitchell about it. We should talk about it again, Senator.
Yeah, I mean, this will be, the normal process is when a grant comes in, joint fiscal votes to accept it.
All right.
We have on occasion accepted with conditions. Now, these are usually $100,000 grants to hire 3 people to do something prevention.
All right.
And we might, our concern is we don't want this to automatically be a program we're going to have to pay for in 2 years.
Right.
We've never had a grant like this, of this size, and no one wants to get in the way of surge response or emergency response, which, yes, all 150 of us trying to do our thing would. So the question is, but at the same time, we'd like some communication and some discussion as things become more, there's more room to prioritize. And so that's going to be the basic discussion today. And hopefully the leadership has had a discussion with the administration. Hopefully they'll come in with some thoughts on their own as to how we're going to deal with it. But we're a long way from should we do X or Y.
We certainly are, and there's a lot of X's and
If
Ys.
any committee has a thought
Right.
about when it comes to X or Y, where it should go, that would be helpful. So to start that discussion is probably not a bad thing.
Well, I think, and that is exactly what a large chunk of the testimony that we have been taking will lead us to. I mean, we've certainly done a lot of work up to this point that some of the work does not seem to require legislative action at this point, but it does seem to require some resources for folks. So this is the kind of the assignment I think we all have, is to continue to go through the testimony that we've heard and think about what resources could be helpful to solving some of the problems we're hearing about. So I will probably be listening in today for that meeting. Okay. Nellie, is there any indication that Michelle Childs is going to be available?
She's scheduled for 10:30. I can see if she's
Right.
able to come on a couple minutes early.
Oh, I have her on my agenda. My agenda says 10 o'clock. So,
Oh,
Yeah,
yeah. So maybe,
I apologize.
yeah, maybe just let her know. The other thing I want to say before you sign off, Nellie, is that at 11 o'clock, it's not a joint hearing, it's a meeting. I mean, it's a fine distinction, but when you put hearing down, then the public might think that they have an opportunity to participate. So
Okay.
it's just the meeting. So whenever we do this, it's a joint meeting unless it's a special event.
Okay, I'll make that tweak.
Yeah, it's kind of a nuance to our lives.
Sure.
Let's unless someone else has a comment, let's wait until Michelle Childs is here. We're on break for a few minutes.
Michelle,
Hi,
we went on a little break, waiting.
Good morning.
sorry about that. Nellie was like, they're running late. I was like, okay, I'll make myself some tea.
No, that's fine. That's fine. We usually run early, so this is unusual for us.
Oh, okay.
Thanks for joining us. We'll wait for our other committee members and then we'll get started.
Okay, well, this is actually good because I just wanted to run a couple things by you first, just about
Okay.
what I was planning, and you tell me if that works for you, which is, have you guys taken up this issue before?
Only in the meeting that we had jointly with judiciary. So it was very brief and
Okay,
so the House Human Services Committee has
Right.
selected this as one of their priorities. And
Right.
we're allowing for them to move forward with that, but we sort of want to stay connected a little bit with what's going on.
Sure.
and Senator McCormick is attending the Human Services Committee
Yep.
meetings, and we'll have him chime in a little bit later. So that's where
Okay.
we are with it. It's not that we're at this point drafting anything, but we want to
Sure.
stay connected with what's going on.
Sure. What I thought I would do, and I'm, I don't usually, as you probably know, I don't usually cover these issues, but Bryn was super busy on some other things, so I'm picking it
Right.
up. And I do the family law, and so there's a lot of nexus for that.
Yes.
I was staffing Human Services last week on it and have been working on it. And what I thought I'd do is just walk you guys to what's happened to date. So you can kind of see, since the governor's executive order, what's happened since then, where are you now, what's the current law, and
Mhm.
kind of just set up for discussion. And then I have an amendment, that I drafted for Dick, like a newer one based on, so if he wants to bring it up, Nellie has it, if you want to discuss that actual proposal. And then, as you know, Human Services is meeting again this afternoon to have more discussion. So,
Right. So yeah, we'll at least address Senator McCormick's issue. I don't know how much time we'll have to get. We probably won't get into a discussion at this point, but just to know. that
okay.
it's there.
Yeah, I mean, I think obviously if you go deeper into it, you'll have to have all the parties there and stuff. And I think everybody's got the same goal, right?
Yeah.
But it's so complicated and tricky and
Yeah.
really hard to respond to in this kind of setting. So,
We get it. I know it's not easy.
yeah.
And there are a lot of the court issued decrees and divorce decrees and all the rest of it that step right into the middle of some of this.
Right. Yep. Yeah.
Okay.
Okay.
All right. So Senator Cummings is back. We are back. Nellie, we are live. And so Michelle, thank you for being here. And why don't you go through and provide for us an update on what the discussion is around foster care. First, what the issue is, and
Sure.
then what's happening legislatively at this point, the testimony and so on. So
Okay. Great. So good morning, everybody. Nice to be here with you. So I'm going to just start kind of set the stage for the discussion and talk about what you have for current law and then what's kind of transpired since the governor issued the stay at home order on March 24th. So when you have a child who goes into state custody, so you have a child who's been determined there's a suspicion of neglect or abuse. One of the things that's done is that there is a parent-child contact order that is issued by the court. And so and I typically work on those in the context of divorces and in family law in Title 15, but there's something similar in Title 33. And you should have up on the legislative web page for your committee, if you want to follow along on your laptops, there is 33 VSA 5319 that sets forth the conditions and the process for doing a parent-child contact order. So essentially, the court is directed to say, so if a child goes into foster care, the court will issue an order that says, well, you're going to have the visitation between bio mom and dad, and the child is going to happen according to this type of schedule under these types of conditions. It's going to be supervised or unsupervised with this type of frequency, things like that. And so that would be in place. And so those orders are issued in all of the CHINS cases. And so those orders all exist now. And so the issue that's coming up is now that you have something that obviously wasn't contemplated when those orders were issued, and you had the executive order about the state of emergency, and then you have the stay at home, stay safe order. The question is how do those things work together, right? So if you have, essentially you have a child who's in with a foster family, And then you have a bio mom and dad, and you have a parent-child contact order that's in place now and valid. And you involve a DCF worker, somebody providing transportation, maybe it's supervised visitation. So you have state workers involved in the visitation, and you have all of that going on. Does that really kind of comply with the stay-at-home order, or should that child be kind of isolating with the foster family in order to kind of protect and make sure that we're not spreading the virus? And so that's kind of the issue here. And I will just jump to the end of the book and let you know nobody's figured it out yet. So so I'm going to talk to you about all of this and just provide you kind of with some of the questions and the issues to be thinking about, and just let you know, I've been talking with, a variety of people from DCF to the court to the juvenile defender, and, everybody's all, really trying to figure out what's best for these kids, but also for the families and for the community as a whole, and trying to problem solve. And I think it's still a work in progress.
Okay.
So you have the two statutes, you have the parent-child contact order, and then you have and so what can happen is that if you have an existing order, there is the ability to modify that order. And so that can be done either any of the parties can petition for a modification. You could also have the court on its own motion modify that order. And you don't have to have a hearing for a modification if the parties agree. So if there is a stipulation and the parties agree, well, we have this order, but in light of the pandemic that's going on, we're going to say we're not going to do in-person visitations the way that we would in compliance with the original order, but we're going to do 3 times a week. We're going to do FaceTime with the kids. We're going to do phone calls every day or whatever like that. The parties can agree to a stipulation and they can file that and the court can accept that. And so my understanding is that that's kind of what's going on right now. But if you can imagine with how all the cases that they have and all the orders that they have to go case by case by case and determine each, situation, the facts of that particular family, what are the circumstances, considering everything there to make a determination, it's pretty labor intensive. And I think that's what people are feeling a little overwhelmed with by right now. And so the issue has come up about whether or not there should just be an automatic stay of all of those court orders. And so what you have is, again, up on the web page, after the governor issued the stay-at-home directive, then on March 25th, the commissioner of the Department of Health, Mr. Levine, issued recommendations that, and I'll read from this, is that given the governor's stay at home, stay safe addendum to the order that further restricts reasons for which most Vermonters may leave their homes, it is imperative that the exposure risk to all of the people involved in the possible continued exposure to COVID-19 through court-ordered in-person parent-child contact be immediately mitigated through measures to replace in-person contact with remote contact. The Department of Health has already recommended suspending all face-to-face contact for non-essential services consistent with the intent of the governor's relevant orders. Due to the need to protect all Vermonters, I recommend that in-person parent-child contact as ordered in Chin's cases be temporarily suspended, and that the DCF work with parents and foster parents to provide remote or virtual visit options for those families until such time as the governor rescinds the order and its addenda. So that was
Sorry, excuse me, Michelle. Madam Chair, I'm not finding those documents on our website. Are you, or?
We have, the document is on the website, but it doesn't come up when you.
Yeah, it's not coming up.
The link isn't working. So I think that's something we'll have to work on. But the message from Department of Health sounds pretty clear. So we'll make sure that we can access that going forward.
Sure. And if those links aren't working, if you look at the House Human Services Committee webpage from last Wednesday, those documents are there as well. So I don't know if those were working for me this morning. So
I saw them there last night, so we know that
Right.
they're there. Okay, good.
right. So then what happens next is you have DCF based on Levine's recommendation. DCF requests of the court a blanket stay of all those parent-child contact orders. Then you have on March 30th, you have a message, and again, when these are up on Human Services, but they should be shortly up on yours. You have a message from Judge Grierson to Commissioner Schatz saying that the court is declining to issue a blanket stay. And again, since you don't have this up, I'll just read it to you. So the Supreme Court has considered DCF's request for a blanket order suspending in-person parent-child contact in light of the governor's stay home, stay safe order. Specifically, they discussed the impact of the governor's order on parent-child contact in Chin's cases. They do not read the governor's order as affecting a blanket ban on parent-child visitation. Further, they believe that superior judges should continue to address motions to stay or modify parent-child contact on an individual basis, which allows them to take into account specific circumstances of the case before them and exercise their discretion accordingly. So DCF requested the blanket stay, the court declined, and that was on the 30th. I'll also just want to draw your attention to, there was guidance put out by the U.S. Department of Health and Human Services for the Administration for Children and Families. And on March 27th, so in between DCF's request for a blanket stay and the court's denial of the request for a blanket stay, the feds issued some guidance on all of this. And when you can pull it up, if you go to page 3 of that, they talk about the parent-child contact, and they recommend against a blanket stay. And so again, I'll just, since you can't see it, I'll read it a little bit. The feds strongly discourage the issuance of blanket orders that are not specific to each child and family that suspend family time. Doing so is contrary to the well-being and best interests of children, may contribute to additional child trauma, and may impede the likelihood of reunification. And then they list they have a list of recommendations. So those are something that you will want to take a look at some time. And I think if you move toward, hearing from other witnesses like DCF and the juvenile defender and stuff, they can talk to you more about those. So that's generally where you're at. And so I think, I do know that DCF and the juvenile defender and others are all working together to try to figure out some way to address this. Right now, it's still going on a case-by-case basis. My understanding is that DCF has been able to reach agreement between the parties for the vast majority of families, that there's really only like about a couple dozen who have not agreed to substitute kind of electronic communication for in-person, but they can kind of update you as to where that is. But I do believe that they are going on a case by case, even on those ones where there's agreement and they're doing stipulations as to the new conditions. And so I think, hearing from all of them about where things are at and what would be helpful to address these conflicts at this point would be good.
Do you have a sort of a number of the total number of cases that we're talking about? I know we have that somewhere
Yep. When Ken testified last week, I think he had said that out of about 900 families, there's about 30 who are refusing virtual visitation. But they expected that number would increase. So, that you may see now that the governor's stay-at-home order has been, extended for another month, you may see more who are not comfortable with denial of the in-person.
Okay. Wow.
And one thing, just as an aside to mention, I don't think we necessarily need to go down this rabbit hole, but I will mention, and you're probably familiar because you work on these CHINS issues, that parents do have a fundamental right to care and control of their children, but that's always assuming that you have a fit parent making decisions, right? The state does have the ability, obviously, to intervene when there is a concern about neglect or abuse. So while parents, so the issue may come up around if you're denying in-person visitation, is that such an infringement on the parent's constitutional right to parent that it's impermissible because you're doing it like with a blanket stay, you're doing it without due process, you're doing it without a hearing, without them, having a say in things. But, we're kind of in, new territory here with the executive order and the pandemic, and how that's all going to play out and how those things work together or don't is a question.
Yeah. Good. Thank you. This is very helpful to us. I think it really highlights the controversies that are out there and the concerns, and then the legal basis for decision making. Senator Cummings, you have a question.
Just a question. Do the foster parents have any say in this? I mean, can they just say, if that child is going back and forth, I'm out of this?
I think that, yes, and that is, I think one of the primary concerns for DCF is that, oftentimes you may have older adults who are serving as foster parents, and so they may, be more vulnerable due to age or physical conditions, and so they may not feel comfortable with the child going back and forth, or who they may be exposed to during visitation, and so I think definitely one of the concerns of DCF is that some foster parents would say, well, if I have to comply with the original order, I'm just not going to do it.
I'm out. Okay.
Yeah.
But that's been a lot of the concern, is for the foster parents, but they can pull the plug if they want to. They can say, that's it. Okay. Thank you.
Thank you. That was a good question. Helpful. Any other questions for Michelle? Senator Westman? No. Okay. All right.
That just brings up a comment that we have so few foster parents that we can't afford to lose any.
You're right. Makes it very difficult. Well, it's interesting that at the federal level, that Health and Human Services came out with the statement that it should not be a blanket conversion to remote access. So I don't envy what the Human Services Committee is doing right now. This is not an easy subject. So what time is it? It's 10:30. We have lots of time here. I think what we're going to do is we'll ask Senator McCormick, from your perspective and what's been going on. I know that you have been very interested in this from the beginning, in particular with respect to the Department of Health issues. So maybe you could give us your perspective at this point. That would be helpful.
Thanks. Madam Chair, I think we really are facing a Sophie's choice here. This is, choose your bad solution. On the one hand, there is the public health issue and the prospect of failing to rise to the occasion on public health. On the other hand, there is the matter of children who have already been traumatized by, first of all, whatever was the situation at home that led to their being removed in the first place. There was probably something traumatic and terrible there. Then there is the removal from the home, which is even anyone familiar with this issue knows that even children who have been in terrible situations at home, being removed from the terrible situation is traumatic because they still love their parents. That's home. That's where they're used to. Now they're in exile. They are uprooted, and there is a sense as well of stigma. You're in the foster home, no, because your own parents were, at least have been accused of failing to take proper care of you, and that the kids feel that reflects on them as well. It's a bad situation, and to further deny them physical visitation with their parents is, of course, painful. So it really is a Sophie's choice. The language I've proposed actually does not take a solid position on one side or the other. What it does say is it addresses the question of what is the default absent a court order. Our colleague Joe Benning and the courts, and I guess the feds have argued that this should be decided case by case, individually by the courts. You should not have a blanket rule. But de facto, there is a blanket rule. It can't be avoided. If you need a court order to have the public health regime respected, then it means absent a court order, the public health regime is not respected. Rather, the visitation order takes precedence. That is the de facto default. What I'm suggesting is that the de facto default, absent a court order, should be that the public health regime prevails. And people who, for whatever reason, do not find that acceptable, they have the option of going to court. So that in a more practical sense, the natural parent has the option of going to court to be granted physical visitation with the kids, as opposed to the health department or DCF or the foster parents going to court to have the public health regime take precedent. I would suggest that the main reason for this is public health. Is for that the heartbreak and the difficulty of denying visitation is justified for the same logic by which we justify shutting down otherwise viable businesses that are, somebody's livelihood, somebody's dreams, somebody's life savings, taking working people who are living paycheck to paycheck and saying, oh, suddenly you have no job. There's all sorts of terrible things happening now that we have said they're terrible. We're not heartless. We're not oblivious to that, but it's necessary. And that this goes into that category. But the other thing is the foster kids themselves, is that if a kid has now been made into a potential vector, and the kid has had the physical visitation, that kid goes back to the foster family as a potential vector, then you now have a little bit of exile within the exile, that the kid's going to have to be quarantined from the foster family. And that is an additional psychological abuse of the kid, not to mention the fact that it's jeopardizing the possibility of COVID-19 infection. So that's my logic, that's my opinion, and that is reflected in the language that I asked Michelle Child to develop.
So Senator Cummings has a question. I'm just, and then I have a question after that. Senator Cummings, go ahead.
No, I don't have a question. I think my argument would be we've already done this. If maybe not in law, but if you've got 900 cases and all but 25, 30 of them have agreed to something else, then that is the default right now. You've got 25, 30, probably very difficult cases,
Mhm.
probably with very difficult parents. I'm not sure we'd gain anything by doing this except make people go to court and expose more people. I mean, it's a month ago, this probably would have been good, but it's worked itself out. And I don't know if by changing the default, we're gonna work the last few cases out any more quickly.
So-
And no one wishes more than I do that this had been taken care of a month
Yeah.
ago.
Right, I think that Senator Cummings, that was my my thought, that if we have all but some of the most difficult cases sorted out, then why would we change it at this point? But I think we need to keep our ears and eyes and minds open as this goes through the House committee. And certainly the extension of the emergency order, as Michelle has said, might increase the numbers of people who are wanting to have visitation resume, not just remotely, but physically. So as soon as, so Senator McCormick, one of the things that you did say was we're all sacrificing, we all are.
Yeah,
There's no question about it. It's the concept of children, that when you put children in the middle, which they are, it makes it that much more difficult for this type
Yeah.
of emergency decision. Yeah.
Yep.
Questions committee, any other questions for Senator McCormick or for Michelle? No.
Hmm.
Senator Westman.
How fast is the House bill moving? In the House committee? Do we know?
I know that they've been taking testimony right along. They've got more testimony scheduled today, I think, right, Michelle?
Right.
Do you have a sense of any of the speed with which they're moving on this one?
They're working pretty hard on it.
Yeah.
They met twice last week on it and
Yeah.
are discussing it. And they've got, and so I think they've really kind of fleshed out the issues, and they've got a number of people on the witness list to kind of be part of the discussion this afternoon. And so I would imagine that by the end of today, because their meeting is, I think, from 2 to 4, that, they will have a direction. So.
Okay. That's good for us to know.
Thank you.
Yeah,
Yeah.
good question. I will also be talking with Ann Pugh, Representative Pugh, to get ourselves updated on who's doing what, when, and where, and how. The issue for us, I think, is regardless of how quickly the committee works and moves on this, there's also the question of how it passes from that committee to the full House, from the full House to the Senate, because they're just beginning the process of deciding how to vote electronically. So,
yeah, I would say that the barn door at present is wide open.
yeah,
The
Yeah,
cows are gone.
we
Yep.
gotta get that little puppy dog out there to herd him around.
Yeah.
Okay,
And just to mention, it looks like they figured out the document issue, so those should be up on your webpage now. So
excellent, thank you. Good.
Yeah.
We'll look at
Thank
that.
you, Michelle. Thanks for
Sure.
the good work.
All
as ever.
right, great. Thanks. Good luck. I'm going to sign off.
Terrific. Thank you very much. And Senator McCormick, thank you for staying on that one. I'm assuming that you're going to those meetings.
Yes,
Okay, good.
Yes.
That's great.
I'm more or less Zooming from 8:30 this morning till 4 this afternoon.
That sounds so familiar. I don't know. I think we're all on the same Zoom.
Yeah.
wavelength.
Jeanette White, Jeanette's gonna have to be more tolerant of people eating on camera.
All right. Committee, unless there is something else that you would like to discuss right now, what I'm going to suggest is that we have Secretary Smith coming on at 11, and the House Healthcare Committee is going to be signing in. Let's take a break until between 10 and 5 of, if we could get, just be available as the House Committee comes on, and then we'll begin our meeting with Mike Smith, Secretary Smith, at 11. So we're on break. You're welcome. If you're
I still
not,
haven't been able to get those documents to come up.
you still haven't been able to?
Mm-mm.
All right. We'll work on that. Nellie and Julie are awesome at getting things to work. So
Yeah, okay.
we will eventually see them. And as Michelle said, you can go out to the Human Services webpage. I forgot what day it's up there, but you can find.
Yeah, I tried that too, and it wasn't. It
Huh.
seems like there's something wrong with the URL that. It's
Okay.
to, but anyway, yeah. Eventually.
All right. As usual, right?
Right.
Okay. So take a little break, and then we'll be back a little before, about 10 of, I'll be back. All right. We're on break. Whoever's whistling, we can all hear you.
I'll shut up then.
Yeah, you may just want to mute yourself for the time before we meet, that's all.
I guess I'm early enough, aren't I?
Yes, you are. You're right on time. You get
Should
a
there
gold,
be- Should I be
gold-
looking at something besides just the Vermont flag?
not yet. We're on break till a few minutes before 11, when Mike Smith will be scheduled to be at the committee meeting.
Okay, are we gonna get together before 11 o'clock or?
Yeah, we're gonna try and get on about 5 of. Let's hope
Okay.
everybody's there. That'd be great.
Okay, I guess I'm early then. I didn't
Yes.
realize people were listening to me whistle.
Oh, it's a good whistle. It's a good
I
whistle.
I didn't even know I was whistling. I just do it all.
It's a great whistle.
So, me and Warren Kitzmiller.
Yeah. We're early. Morning, Bill.
Good morning, Jenny.
How are you?
Good.
Good.
I take it
We're
your
on
other testimony finished up for a while.
Right, so we're gonna, everyone will be back on by 5 of, and so then we'll just have
Okay.
a little organizational chat, and then we'll listen to Mike Smith as soon as he gets on.
Okay, great.
I just want to know, Ray, is Peter or Brian, which of you is a whistler? Who's the whistler on your committee?
The Whistler?
Yeah,
It's not me.
okay. Who was that, David? No. Smith, as soon as he.
It's Brian Smith.
I just want to know, Ray, is Peter or Brian, which of you is a whistler?
It's
Brian.
Brian Smith.
Brian's the whistler.
Oh, sure. I bet it's Woody.
Who's the whistler?
It's
On your-
Brian Smith.
The Whistler?
Yeah,
Yes.
Not me.
okay.
I whistle all the time unconsciously. I apologize.
I want to know, wait, is Peter or Brian, which of you is a whistler?
Brian Smith.
Brian's a whistler.
Whoever it is, John Grisham wrote a whole book about him,
Brian Smith.
The Whistler?
Yeah,
the Whistler.
okay.
I whistle all the time unconsciously. I apologize.
Oh, no, wait, is Peter? Yeah, which of you is a whistler?
Smith.
Brian's a whistler.
Whoever it is, John Grisham wrote a whole book about him.
Good morning, Mari.
Good morning.
How was your shift?
Interesting.
I'm sure.
What shift were you on?
I worked the last 3 days, 12-hour shifts at the hospital.
Uh-huh.
Are
Did
we
you
on
get-
YouTube? I should ask, are we being streamed on YouTube right now?
Yep.
It looks like we are.
Yes.
Okay, so let's just be aware of that, I guess. I will
Can
be
can
more
anyone, can
aware.
anyone hear me yet?
Yes,
Yeah.
Brian.
Okay. I didn't know if you could or not. I got so many different, there's a lot of controls here I'm having confusion with.
So my suggestion is, say hello and then mute yourself until we go live or as we go live so that we're not clouding up the sound waves.
I'll mute myself so that I can whistle.
Nellie. Nellie, I think what we probably could do would be to put the screen up with all the House and Senate members at this point and take the cover page down so that people know we're going to be going live in about 8 or so minutes, and just so we can see how many people are here.
All right, I can do that. I'll take down the flag.
I love the flag. Yes, great.
It was great. I hadn't seen that before.
Yeah. Good, thank you.
Hi, this is Ann. I'm I guess I'm in the holding bay with you guys, but I am by phone because my Wi-Fi's been dropping in and out all morning. I got dropped from another Zoom meeting, so.
Okay. As long as you can
Figuring.
hear what's going on, that's good. We can hear you just loud and clear. And
Oh, good. Yep, I hear you fine.
terrific. And so what we're suggesting is that when you come online and we know you're here, say hello and then go mute, just so we don't have a lot of confusion.
Lori's here.
Good morning.
Hi.
Lucy's here.
Good morning.
Woody's here.
Good morning.
Mari's here.
Good morning.
Brian Smith is here.
The Whistler is here. Good
Yes,
morning.
I am. Sorry.
Good morning, David's here.
Bill Lippert's here.
Morning. Anne Marie is here.
Ann Cummings is here.
Good morning.
Good morning again.
Again.
Rich Westman's here.
Good morning.
Good morning.
You're muted, Senator Ingram.
Debbie Ingram's here.
Good morning. Good morning, Secretary Smith.
Good morning.
Thank you for being here. We're going to hold off until the dot of 11 and then we'll get started. We're going to start in just a couple of minutes with organizational strategies so that we don't overwhelm you.
Okay, thank you.
Appreciate your being here. And Candace, I saw was on a minute ago.
Yes, I'm here.
Okay, good. Thank you. And Brian, you're on. Brian Chena, good morning.
Good morning.
Good morning, Brian.
Good morning. So why don't we get started, Bill? I don't know whether your entire committee is here. I have one person who hasn't come back on yet, but I'm sure he will be here soon, Senator McCormick.
I think we're all here. I'm just
Okay.
kind of counting the squares. And I think we're all here. And Ann, just so people know, Ann Donahue is here by phone this morning because she's having internet
For the afternoon,
or
Okay.
afternoon.
which I am participating.
Oh, you are? Okay, good. Senator McCormick is here. Terrific.
Okay, so I think our folks are here.
Okay, so we're all together. Thank you. This is a joint meeting between House Healthcare and Senate Health and Welfare. Senate Health and Welfare has already been meeting, so this is a continuation for us. But one of the, and as you know, we will be meeting together again tomorrow. I'm gonna look at the times at
It's
10:30 tomorrow.
10:30 tomorrow.
And then again on Thursday, we'll be meeting together beginning at 9:30 and going through some fiscal issues with Sarah Clark and then listening to North Country Hospital and David Green from VAS. So I think this is important for us to continue to work together. Bill and I have talked about how to structure some of this and we'll continue to do that. We're not always going to be on the same page in terms of what we would like to hear, but when we can, it helps us work smoothly together as we did with H742. And I want to thank the House Committee. While you're all here, the Senate very much appreciates the work that you did in getting that bill to us so that we could work quickly and efficiently on the bill. So this is a thank you from our committee to yours.
Thank you.
All right. And before I introduce Secretary Smith, Representative Lippert, did you want to say anything?
Yes, I want to just acknowledge as well that Ginny and I have spent some time talking together, and I very much appreciate being able to collaborate. I think it's going to be responsive to the needs of very, very busy witnesses such as Secretary Smith and others in this critical time that we, as much as possible, coordinate. And we have, as the House, join the Senate during the morning period that they have scheduled. And we will continue to do that when we can have a joint meeting. And when we're having separate House Healthcare Committee meetings, it will be in the afternoon. And I'll talk to our committee more about that later. But again, I want to express my appreciation to Senator Lyons for helping us think how to collaborate throughout this week and into the future.
Terrific. This is great. So Secretary Smith, would like to welcome you to our joint committee meeting. Thank you for being here. We know how busy you are. We probably don't know how busy you are.
Sure we do.
I can only imagine. And so our initial goal is to hear from you about the implementation of H742. There will be questions. I'm going to suggest to our committees that we hold off for a bit. Let Senator, I didn't want to demote you. Secretary Smith provide information, and then we'll have to raise our hands and be judicious about the number of questions we have. We'll begin with the chairs and then vice chairs and then go from there. So Secretary Smith, I'm simply going to turn it over to you at this point.
Well, thank you, Madam Chair. For the record, Mike Smith, Secretary of Human Services. And I thank you for getting together. This is a good format in these unprecedented times, and I thank you very much. I'm going to start out talking about the implementation of H742, Act 91. And then if it's okay with the Madam Chair and the Chair of House as well, I'll open it up to whatever anybody wants to talk about. I'm willing to talk about anything that may be on your mind in terms of what's going on, because there's a lot going on. And if I can't answer some of your questions, I'm sure Candace will write it down and we'll try to get answers to your questions. But in general, and taking it at a high level, because I know that many of you have had some testimony from people like Corey Gustafson, our commissioner of DEVA, who's done a really good job sort of outlining some of the steps that DEVA has taken during this crisis, and they've been quite substantial. So I'll sort of bring it together at a high level. At the same time, Candace is ready to submit a memo that really gets down into the detail of the various things that this agency has done. At the outset, let me just tell you, I couldn't be prouder to be secretary of this agency. It is amazing what people have done over the last 6 weeks with little sleep or little rest in terms of what they've been doing and how they've been doing it. I have a 3,600 person agency there approximately. I'm proud of every darn one of them as we move forward. So I'm here to talk and how it's worked to implement the various provisions of Act 91. Let me start by thanking you and the fellow legislators for taking quick action in a time of crisis to enact legislation to allow us the necessary flexibility to respond to this crisis. As we have talked about, the COVID-19 pandemic is unlike anything our state or country has experienced. It has required all of us working together to help our state and neighbors, and we will need to continue to work together to make sure we fully recover from this unprecedented event, like I said. In the week since we've had our first confirmed case, we have been working to continue our mission of supporting Vermonters, as well as to make incredible adjustments to how we do business. We continue to make those adjustments every single day. The legislation that was enacted in quick response to this crisis has both directed and permitted our agency to do the necessary work to respond quickly and thoroughly during this time. I will, like I said, Candace will leave you with a memo that includes the response from each department on how they have implemented the different provisions of Act 91, and it's been pretty extensive. but here is just a sampling of some of the work captured in the memo. We issued guidance to our community providers on how to protect their staff and clients. We did rule variances along with emergency rules when appropriate. Directions and announcements were put out by the health department on how qualified Vermonters can obtain a temporary license during this crisis. Major expansion and continuation in telemedicine, telehealth with a variety of providers and services. In particular, Vermont Medicaid has expanded payments for telephonic services furnished during the emergency response to COVID-19 to specific services, including applied behavioral analysis, physical therapy, occupational therapy, speech therapy, choices for care, home health, hospice, family supportive housing, and children integrated services. There's others, but I just highlighted a few. We launched also a Medicaid retainer process for providers that are experiencing cash flow challenges during this crisis. To date, 13 provider organizations have applied and have been awarded financial assistance through February of April 10. The total dollar amount is about $825,000. As of Monday, April 13th, a total of 35 provider organizations have submitted applications. I want to stop right here and just sort of explain what we're doing, because if you look at this as a 3-lane highway, what we're trying to do is make sure that our healthcare system doesn't collapse. That's basically what we're trying to do. And as we look at it, we have one lane that's providers, FQHCs, other providers that are in that lane, and there's a variety of providers that we can look at, and those are the providers I was just talking about in the first tranche of financial assistance that we provided, and another tranche that we're looking at right now. Then the next lane is I like how I use my hands. I've never seen that before, but the next tranche is, the next lane are the hospitals. And we have some hospitals that are in crisis that we have helped out. Springfield being one of them. We've issued $1.3 million to Springfield. Grace Cottage has requested $725,000, and the Brattleboro Retreat has requested money as well. And we're still working the specific arrangements out of what that will look like, but it's not going to be a small sum. I'm gonna be honest with you on that. But there are other hospitals, I would say those are in the red area. There are other hospitals that are teetering between orange and red as well as this goes on. And there are some hospitals that we'll have to look at as we move forward. The next sort of lane that I've been looking at are the DAs and SSAs, because they're critically important to our healthcare system as we move forward. And one of the things that we've done, we've looked at this in phases. Again, I got to stop using my hands, but we got to look at this in phases. And phase 1, with the DAs and the SSAs, we provided monthly prospective case rate payments and provided flexibility within the daily rate billing and adjustment to the end of the year reconciliation process to reflect changes in utilization and delivery of services due to COVID-19. We also, through DMH, implemented an emergency case rate for Success Beyond 6. That's the school-based mental health services program to allow continued provision of services and support fiscal stability for DAs. We've also, through DMH as well, provided expedited payments for electronic medical record implementation. And that's phase 1. Phase 2, we're just starting to put together, and that's to look at a request from the DAs and SSAs on a financial relief process, mainly because of staffing issues that they're having and some of the issues that they're doing along that line. So 3 lanes, trying to make sure that we keep healthcare system viable during this time and continuing during this time. We need the beds. We need our system to come out of this in a way that maintains healthcare in this state in somewhat similar stance as we went in it. There are going to be changes along the way. I mean, there are always some changes when you have the incidences that we've had in terms of stress along our system, but we're trying to move forward. The other thing for the individual, obviously, you know that we extended the special enrollment. We launched a special enrollment period on March 20th. We currently are discussing, we're going to extend that. My notes say we're discussing, extension, we're going to extend that. The special enrollment period. One of the questions that keeps coming up, and some have asked about this, will the stimulus checks and will they impact eligibility for Medicaid? And CMS has indicated to DEVA that stimulus payments will not count for any Medicaid eligibility, but the department is waiting for written guidance to confirm. We've been told it will be addressed in the next set of FAQs to be published. I think I want to, at a high level, I want to stop there. The memo that you're going to get is pretty detailed on the various things that we're doing, but I haven't had the opportunity to sort of sit down and talk with you about the various things that are going on, and there's a lot going on. I just want to take some time and not a lot of time, but some time, and answer some of your questions that you may have. I mean, we've expanded our testing. We have looked for, one of the things that we've been doing lately is looking at those, besides the fact of trying to make sure that our healthcare system doesn't collapse under the fiscal stress that it's currently under, but also looking at what I would say populations that are affected by COVID-19, whether they're healthcare workers that need a place to recover, or healthcare workers that are positive and need a place to recover, whether it's disabled, whether it's homeless, looking at those special populations. And as you know, yesterday we announced that the Holiday Inn in South Burlington is one of those places. I want to say this too, and I want to sort of emphasize this. I wish we had more time to move dialogue at a normal pace. I know Plainfield was a little upset with us in how quickly we were moving. I know St. Johnsbury was upset at how quickly we were moving, although we did notify the community of the surge site there. The normal pace of a dialogue in the placement of facilities, is months, maybe even a year or so. We just don't have that time. And so, conversations that would normally be held over months by necessity, conversations and action are done in days. And as we look to handle all the populations in a safe and responsible and caring manner, we try to do as much as we can to inform people. And I would say the bulk of the time we get it right. We get some things wrong. I mean, in St. Johnsbury, we should have informed the hospital of our transportation plan, which was to move patients in case they got sick in our prison population there because we moved them from St. Albans, those that tested positive St. Albans, to St. Johnsbury, where we had set up a surge site, that we should inform the local hospital that we had a transportation plan to move them to UVM and not have them feel that they were going to be overwhelmed with patients, and that wasn't the case. We own that, and we are you know, we're not perfect in how we're moving forward. But with that said, the reason I've launched into this and sort of off topic, because I am so darn proud of Vermonters. I mean, we opened surge sites at Patrick Gym, at the Champlain Valley Fairground, at a hockey rink in Rutland, a surge mental health facility in Essex, and possibly in Springfield, a special population facility, like I said, in South Burlington, and others around the state. And Vermonters have rallied to their fellow Vermonters. And that is something that is amazing to see. Now, I have been disappointed in a couple of comments that I've seen in newspapers in particular, and some of the things that have come back to me, like we should put up fences around these temporary sites that we're putting people into, you know, an isolation and recovery facility, or they should wear special uniforms or something like that. We're not doing that. You know, we have a history in this world about doing things like that. We're not going to do that. We will be as safe and as responsible as possible. We will provide PPE for those people who are caring for these people. We will make sure that we will test where we can along the way as well. But we are not going to put a scarlet letter on people who unfortunately could be any of us sitting here, you know, broadcasting here. It could be any of us. So we're not going to do that. But that very, very small minority, I don't want to cast, because the vast, and cast, you know, aspersions over the vast majority of Vermonters who have been compassionate. And, you know, some of the things that we have done, we met with local officials in St. Johnsbury last night. We met with people in Plainfield. They have done a pretty good job. In terms of state facilities today, we are finishing up testing the entire vet's home. I want you just to be aware of that. We have, there was a March 15th case of a staff person who tested positive for COVID-19. That case was, that person isolated for 14 days, had 2 negative nasal swabs after that fact. And we had no patients or no other staff test positive. But out of an abundance of care, I ordered that the veterans home be tested over the weekend. And we're in the process of testing 122 veterans there and 200 staff. That should be done today. I'm just trying to think if there's anything else that I may want to talk about. We have expanded our testing. This is something that we did last Friday. We said that we have broadened our approach to testing. We'll do universal testing for nursing homes, corrections, those homes that house disabled or people with disabilities, residential treatment facilities, assisted living facilities, state psychiatric care facilities, when we've detected a case or cases in those facilities. The other thing we've done is to bring you up to speed on some of the things we've done just recently. And I want you to be aware of it, is that if you're transferring from a hospital to a nursing home, for example, or to a long-term care facility, you'll be required to test. And as you enter that long-term care facility, our guidance is you got to be quarantined for 14 days into this. We think, and as we go back, the areas where we had issues within long-term care facilities were from transfers that were either coming in or going out of the facility. We finished testing at what is called Decker Towers. That's in downtown Burlington, a fairly large senior living facility. It's not a long-term care. It's not a care facility. It's a senior living facility. The reason why we're testing there is because there had been 2 recent deaths, and we have just discovered through testing that none of those deaths were COVID-19 related. But we did have a person self-report that they had COVID-19 within that facility. We have tested 139 people in that facility, and I think I should have the results today on what is going on. So I'm trying to get you up to speed as much as possible, and that's where we are.
Thank you. And thanks for bringing up the prison issue and also Plainfield. And before we move into questions, I just want to thank Candace Morgan for the work that she did on Plainfield and bringing some of the local senators and reps together on that. That was extremely helpful. And I'm hoping that the same thing is happening with St. Johnsbury, so that those folks are reassured.
Madam Chair, we had corrections met with the select board last night, and it was a very good meeting. So
good. That's very helpful. Senator Cummings is here, and I think she and I agree that the work that was done with Plainfield smoothed the waters quite a bit.
Right. And by the way, Senator, Candace runs the agency, just so you know.
I got that impression. I don't know. She's a good right-hand person. I know that.
A very good right-hand person.
So I know a lot of questions. You've covered some of the issues I think that people are interested in. I would have questions. I have a lot of questions, and I think that as we go forward on some of the fiscal issues, we'll be diving into that in our committee. So I will hold off on some of those questions for now. But just knowing that the Healthcare Committee in the House does not, Bill, and correct me if I'm wrong, you don't have oversight over the Department of Health. That is not in your jurisdiction, yes or no? You're muted.
You're on mute.
You're muted. You're muted.
That is correct. We have a bit of a permeable boundary between our Healthcare Committee and the Human Services Committee, or the Human Services Committee in the House, and they primarily have public health jurisdiction in their committee, although we sometimes are involved.
But having said that, the protocols that we're asking to have put in place for all of our healthcare workers and people who work within the healthcare environment, if they're environmental services workers or whatever, those protocols I think are important to all of us. And
absolutely,
I guess one of the questions that I would ask, because we've heard so much about it, is what protocols, common protocols, are we going to be seen distributed out to places like grocery stores, places like res care facilities, and are those protocols have they been developed? I know we can find them sometimes on a website, but the frustrating part is having done all the work and knowing everything that has to happen and all the good things Department of Health is doing, and how that gets conveyed out into the community. Just maybe you could help us with that.
That's a very good question, because protocols, writing protocols and just putting them up on a website isn't the complete answer. And through Dale, through DMH, through the Department of Health, we've been holding regular meetings with stakeholders on protocols when they're developed and when when they're put out. Not only that, we've also developed rapid response teams to go out and check, especially in our long-term care facilities, go out and check and make sure, A, they have the PPE that they need, and B, that they're adhering to the various standards that they need to do in terms of protecting their clients from COVID-19. We continue to do that. We've been doing outreach. We did that over a weekend. We went out to 39 long-term care facilities, plus those are nursing homes, plus others as well. I don't have the complete number in my head in terms of what they did, but we will continue to do that. The commissioners, from Monica Hutt to Mark Levine, usually in conjunction with Mark Levine at Health, have been reaching out to the various constituencies. That includes Sarah Squirrel, as well as the commissioner of the Department of Mental Health. The other thing that we've done is make sure that we stay in communication with hospital CEOs out there and have had regular conversations with them on what we're seeing and what we're doing and what they're doing, and having and what they need, mostly money from the federal government, by the way. But it would be, we are in constant communications with those various entities. For example, when I put the visitation policy into place, because that came out of the Secretary's office for hospital visitations, I was in close contact with the hospital association to make sure that they understood where I was coming from and some of the things that we did. Somebody asked me this the other day. They said, what was the hardest decision you had to make here? And I, there's a lot of decisions that you have to make, but one of the hardest decisions I think I made was closing access to nursing homes. That affects people in an awful way, because you can't see your relative, you can't visit your relative in these times. And that was a pretty difficult discussion and decision at the same time when we had to do that, but it was the right thing to do. We had to make sure that we stopped the spread going into those long-term care facilities, because we knew that older people, my age group, by the way, is the vulnerable population. I never thought I had to say that. I used to be the youngest person in the room. Now I'm the oldest person in the room. But and Dick McCormick, he and I used to have dark hair. But
Wait, you're only as old as you think you are.
Okay.
Until you're in a pandemic, and then
Yeah.
your age gets.
Yeah, I've aged about 8 years here in the last 6 weeks. But these decisions we tried to convey, we try to have meetings, we have constantly upgraded and communicated with PPE in particular, making sure that everybody is fully stocked. And by the way, our PPE in this state, we're in pretty good shape, as well as our testing, by the way. I got to tell you, through ingenuity, through luck, through hard work, through Vermonters being strategically placed throughout the country, we've been able to turn a fairly limited testing protocol into a very robust testing call. Now, do we have unlimited testing? No, but we have really good and robust. That's why we opened it up to nursing homes and corrections and residential treatment and all those others that we opened it up if we found a case.
So, Secretary Smith, I want to make sure that we have some time for others to ask questions. I have a bundle of questions. I'm holding on to them. I'm going to I've got a list of people, and I'll let you know who they are, who have indicated they'd like to ask a question. And this is after Representative Lippert. But I have Brian Smith, Mary Cordes, Lucy Rogers, and Senator Ann Cummings. So I've got that list, and if I'm hoping that these will be very clear, concise questions. so that we can get the answers similarly.
Yeah, I'm hoping as well that the answers will be the same way.
Representative Lippert.
Let me very quickly acknowledge the extraordinary work that the agency is doing, that the Department of Mental Health, we've worked very closely with Commissioner Squirrel and DEVA and Commissioner Gustafson and his staff. They've been very responsive. I will acknowledge I've been communicating with Commissioner Gustafson about extending the open enrollment period off. We've been doing that offline over the past week. And just this morning, he indicated that they're very close to making that formal announcement, which you alluded to as well.
I guess
and I said I wouldn't announce until he had told me, but I think we're saying it. I also want to acknowledge the very, very important role that DFR has been playing. That the Department of Financial Regulation in issuing bulletins has been absolutely critical. And I understand they have several more bulletins that are in the works about insurance. And that part has been very, very important, as well as the Department of Health. I think I'd just like to say, maybe one question I have, and it has to do with finances. I was on a call yesterday with, I was invited to join the call for the legislators with the Counseling Service of Addison County, one of the DAs. And they indicated, as I've heard from numbers of other settings, where they're having to frankly offer and wanting to offer additional compensation to workers, particularly in residential settings, where it's critical to keep the group homes and residential settings whole. To keep them fully staffed, and some of the conflict, both by fact of the difficult work, and then the conflict that has arisen through the federal unemployment insurance, which is undermining in some ways, or pushing us to frankly compensate workers at a higher level, and what they described as appreciation pay, bumps of in some cases $2 an hour, et cetera. I want to ask and know if that type of action on the behalf of whether it's a DA or whether it's another setting is going to be reflected in keeping them financially whole.
Before you ask that question, I will say that the Senate Health and Welfare Committee has spent an extensive amount of time on this issue, and just in trying to understand who it affects and who would want to quit work and go to UI. So there are a number of folks in Dale and
Yes.
other areas. So this is a critical issue. So
Yes.
Secretary Smith.
Yeah, let me answer that question. And it's a very good question, and one we're on top of. Like I said, we've looked at this in two phases. Phase one, the prospective case rate, the implementation of the emergency case rate, and getting money to them in the most expedited manner that they can, including the the electronic medical records. But phase two, which we're working on right now, is, and I would think that we would have something fairly soon, real soon, by the way, that addresses the issue that you have talked about. The staffing issue at the DAs is exacerbated by just about what you just said, the federal government, a UI sort of situation, but is also in the early stages by fear. I mean, people didn't want to show up and fearful about what is going on. There was a lot of, a lot of things going on in the early stages of this virus. We aren't over this. I don't want to say that, but there were a lot of things happening there. We're trying to get some relief out to them. I think I'll have more details by the end of the week.
Good, thank you.
Thank you. I think I'll hold my questions. But there's many of our committee members who would like to chime in. And I'll leave it to you to call on people.
I've got a list. I've added, after Cummings, I've added Durfee and Page. So I've got you folks.
Senator Lyons.
Yes.
Representative Lippert asked my question.
Okay.
So you can take me off for now.
All right, we'll take you off for now.
And Senator Cummings, thank you very much for your help with Plainfield as well and getting legislators together. We really appreciate that.
Brian Smith, you have a question. Where's Whistler?
You're muted.
You.
There we go.
There
Thank
you
you.
go.
Thank you very much, Secretary Smith, for having this meeting today. I've had a number of calls from people in the area wondering, you know, the whole big motto right now is stay safe and stay home, but you moved over 20, I don't know how many prisoners you moved into the Northeast Kingdom that are infected with the coronavirus. And Orleans, Essex, and Caledonia counties are very, very light with infections as compared to some of the other areas in the state. Why would you do that?
Well,
why would the state do that, I should say?
Well, we had surge capacity in that facility, and that's one of the reasons we had capacity in that facility, and we separated out the infected into a facility where we had capacity. I think it was the last part of March, we informed both the town and the appropriate legislative committees that we were going to be using that facility as surge capacity. But you could also ask the same question. Every town could ask that same question. I mean, the people of Essex could say, why'd you put a surge facility in Essex? Actually, two in Essex. The people of South Burlington could ask that same question. Why did you put an isolation center in our facility? The people in Rutland could say the same thing. Guys, we're in this all together. And the fact is, just let me finish, Brian. The fact is that if you don't think, you know, you could make the same argument about you know, people coming out of a healthcare facility, for example, in terms of what's going on. Now, we have moved people from St. Albans, where we didn't have capacity, to a facility in St. Johnsbury where we did have capacity. And we have put in extraordinary precautions in that facility to make sure, including, and I think the town would agree with us on this, including decontamination of people entering and exiting that facility. So the PPE is there. You know, would I rather not done that? Yeah, but it had capacity and we had to do what we had to do.
There was where they were, there wasn't the capacity to handle what was going on with them.
No, we had to isolate them from the people that were negative, and that's what we did. And so we have 4 negative pressure rooms in St. Albans. We exceeded the capacity of those negative pressure rooms right there. It's surge capacity. That's what we're talking about in all these facilities. If we exceed the capacity within a certain facility, we can move them. As you know, that's what surge is all about, and that's what we did in this case. Now, did we expect 28 people to be moved all at once? No, we didn't, frankly, but we had the facility ready for it in case they did, and that's what we did.
They are completely quarantined?
Yeah, your prisoners aren't going to get out, I hope.
I mean, they're not having family members coming to visit them or anything?
No, we have stopped visitation long ago with correctional facilities. Matter of fact, we had gone to video visitation long ago. It was way into March that we had stopped that because we didn't want this to become a facility become infected. Unfortunately, St. Albans did, and that's unfortunate.
All right, thank you very much.
Thank you.
Thank you. Good questions. Representative Cordes.
Thank you. And thank you, Secretary. I agree with you. I'm very proud of the work that the state has done, that Vermonters have done. I see it both as a legislator and as a nurse working at UVM Medical Center. And I'm so grateful to all who are pitching in, including my own union, union representing state employees and frontline retail workers. It's, as someone who's worked extensively in disaster relief, this is what needs to happen, and I'm grateful for it. So I have some questions that I will touch on very briefly, and then if I may, I will send as an email, because it goes into more detail, and I don't want to take up more time right now.
My suggestion is if you have those questions, and if the secretary has time to respond by email, which, you know, perhaps it would be his right-hand person, that we would get that sent out to both committees. You could send it to Nellie, and the response, at least to Nellie and Julie, or Demis, probably Demis and Julie and Nellie.
Yes, and can
That would be helpful. Go ahead.
Can I just touch on the issues and then send the email?
Sure. That'd be terrific.
Thank you. The first issue is around EMS providers who are having issues with not having N95 testing, fit testing capacity. They are spending money that they're not getting reimbursed for yet. And I recognize things are moving quickly. So as I say this and share this information from my constituents, I realize that things may have changed. Decontaminating ambulances, federal money, is that going to be coming to frontline EMS workers? And the last comment is that from this local EMS service, the only support that they've gotten is 20 expired N95 masks, old Ebola suits from the last crisis, and 10 face shields. So I will send an email about in more detail about the EMS issues, and especially since it's a little ironic that the H742 was the vehicle we used to do all this amazing COVID work, but the underlying bill was about making sure that existing funds from fire safety assessments get to frontline local volunteer EMS folks immediately. And I'd love an update on, and I've been asking but haven't gotten answers yet on when that money is going to get to them. The last question is about migrant workers, and I realize I'm crossing committee boundaries. So I'll just put it out there and put the rest in my email. There's housing, healthcare. These workers provide us with the dairy that we all love in Vermont and other products.
So I'm going to jump in here, Maury. Let me jump in
Okay,
and say
I was
that,
gonna, go ahead, Bill. Go ahead, Bill.
say that Senator Lyons and I are in conversation about scheduling testimony about dairy workers and health access to healthcare. So it's already on our agenda looking ahead.
Thank you so much.
Can-
And again,
can I-
thank you, Secretary, and your right-hand person, Candace. Thank you so much.
Hey, let me talk about PPE for a minute. We have developed through a lot of sources a fairly good supply of PPE, and there is a process of requesting PPE for EMS and others that are out there. I would urge them to contact the state EOC to get their PPE if they feel that there's insufficient PPE, because we have enough to distribute out there. I'm going to be talking to the hospitals tomorrow because I've heard some issues with frontline hospital workers saying they're not getting the PPE that they need. We've got PPE, and if that isn't the case, then I need to talk to the hospital CEOs, which I'll do tomorrow, to say, where at your facility is there not getting the PPE that you need? Because we've got it, you've got it at the hospital level. Why do the front line, if there are people out there that don't feel that they're getting it, either they haven't been informed of the right PPE they should be getting, or number two, they're not getting it for a specific reason. We need to communicate that out there in terms of what is going on and how it's going on. I want to say we have PPE and we're monitoring burn rates. We're monitoring everything. We're in pretty good shape as a state with PPE, as I mentioned, as well as testing as a state.
Okay, so Secretary Smith, thank you. And I think that is one of my overarching questions. I'm not going to ask it right now, but it was the reason that we invited you in to talk about the implementation of H742, and that is the overarching concern, the more of a question about communications and how that information gets out to boots on the ground. And I think so that this is very helpful, but it's important. And I know in the Senate GovOps is working on funding for our EMS folks. We also in our committee have passed out an EMS bill as well. So someday they'll be over to you folks.
Can I jump in and say, yesterday I spoke with, in response to questions around ambulance reimbursement, I spoke with DFR. They are issuing a bulletin. They have already been enforcing this. I'm not sure where the miscommunication happened, somewhere between constituents in the Senate, but DFR is going to be issuing a bulletin that they already had in draft form, so that the ambulance associations will be getting direct reimbursement as is required by Vermont statute. So that has been resolved.
Thanks, Bill. I do want to say, you know, I want to give kudos to DFR. I mean, they really, you are absolutely right. And I'll extend my time, Madam Chair, because I'm kind of hogging it here for everybody. But they have done an amazing job. Not only have they done an amazing job in what you're talking about with directives, they've done an amazing job with modeling. And that is extremely important as we were talking about surge and getting ready for surge, the modeling that they have done. And as the modeling has shown, we're doing pretty good in comparison to the earlier models, which scared the living heck out of me as we entered this thing. So the actual sort of predictive modeling is something that's essential for us as we move forward.
Thank you for that. The modeling has been great. Representative Rogers, you're up next. And I do have Representative Chena, you are on the list.
Thank you, Secretary Smith, and thank you so much for spending your time this morning with us. I have a quick series of questions relating to the cash flow assistance for Medicaid enrolled providers. I think what I heard you say before was that you've had 35 providers submit applications and have already distributed $825,000. I'm curious if you could give me a sense of what is this the type of situation where any applicant that qualifies will be receiving money? Is there a high amount of competition amongst the applicants? You know, what out of those 35 applicants you've had so far, has it been a high percentage that's been accepted?
Yeah, let me just get the numbers. 13 provider organizations have applied and been awarded. Another 35 are waiting and submitted applications. So we've already sent out about $829,000. I think is the closest figure that I get. It's about $829,000, if I remember. We aren't giving it to everybody and in the amounts that they've asked for. We have a sort of process that we've gone through in terms of what money that they have available, what money they may be getting in Medicaid reimbursement. There's a whole formula that we've been using in these times. So will everybody get everything that they asked for? The answer is no. Will they get some? I don't know if we've rejected any. We may in the future, but I don't know if we've rejected any yet.
Okay, that's helpful. And then is there a cap on the amount of money that's available in this fund, or is it kind of on a rolling basis depending on that application?
It's sort of on a rolling basis right now. I mean, we're not unlimited, but at the same time, we're hoping to recoup some of this money through future Medicaid payments that, once stability gets back in the system, recoup it in future Medicaid payments, as well with the hospitals as well. If they get payments from the federal government or through future Medicaid payments, some of that money, I won't tell you that it's not at risk. It's at risk, but some of that money hopefully will get paid back.
And this is, I'm sorry, go. I didn't mean to interrupt you. Go ahead. I'll ask.
Just a couple more questions.
Go ahead.
Is there a kind of normal amount of wait time an applicant should expect between submitting their application and either receiving money or being notified of the decision?
Representative Rogers, I don't have a specific time period. We've been trying to turn these around as quick as possible.
I mean, with 13 already paid, it sounds like that's been the case.
Yeah, it's been real fast. So it does have to go through a process, and I still want to make sure that it does go through a process, but the turnaround time has been real quick.
Great. And then my last question is just to clarify, it's my impression, but just to clarify that the intention is that this money would be available for independent practices as well as FQHC.
Yes. Yeah.
And is there?
It's a wide variety of providers that we would put.
And
this
is there a priority ranking based on type of provider or not so much?
Not right now. It would be on the need that's out there in the community, I think.
Thank you so much. Those are my questions.
These are all prospective payments?
There are payments that we hope that when stability comes back in, maybe we can recoup some of this money. But I'm not going to sit here and say we'll get all of it back.
Got it. Okay. So Representative Durfee, you're up next.
Representative Chena, I think, has been waiting.
I've got him on the list. He's after Representative Page.
Thank you. And thank you, Secretary Smith. Just a couple things. We had a conversation with Tom D and the folks at the hospital down here in Bennington last week, and there was some conversation about PPE. It followed an article that ran in the local paper that morning or the previous day, asking community members to supply to help contribute masks and skull caps, possibly gloves too. So I might just want to clarify with him what the status of their need is.
Yeah, I will, because we can turn around PPE very shortly on deliveries. So
okay.
I will clarify on that.
Okay, good, thank you. Quick question. How long do we think the open enrollment period will be extended?
I don't have an answer for you right now.
I
do. Go ahead, Bill.
May 15th.
May 15th.
Thank you.
There you go.
That's tentative, not final, but that's what.
Okay, great.
But since we've opened it up, I'm going to talk about it.
I approved
The
opening it
secretary
up.
asked you, it's okay.
Yeah, I approved opening it up. I didn't approve what the date is. So we'll make it the 15th of next month. So there you go.
That works for me. And then Secretary Smith, you mentioned transfers in and out of the long-term care facilities as being potentially the source of problems that we've had. Could you just elaborate on that a little bit more?
Not really. I'm sort of speculating at this point. That's why we put in place these extra sort of guidelines that we're talking about long-term care facilities. If you're transferring into a long-term care facility, you have to be tested before. Now, you gotta understand the limitations of tests. You can test one day and be negative and test the next day and be positive. So, we gotta understand that, but also putting the quarantine aspect of it into place as well. So, those are the two things that we're doing in order to make absolutely sure that we're not spreading it from one facility into another.
Thank you.
All right, very good. Representative Page and then Representative Chena, you're next.
Thank you, Mr. Secretary. I was glad that you mentioned some work that you're doing at the Bennington Soldiers Home based on what's going on in just south of us in Massachusetts and Holyoke area. A couple questions. The Newport prison, if prisoners test positive there, will they also be moved to St. Johnsbury, or is there an area there at Newport in which you can isolate them? And then finally, it seems in the past, states have looked to the feds for assistance in various crises, and they've led the way. The feds have led the way generally. Now there seems to be a trend where states tend to lead the way in being proactive. And I'm just curious, are there policies in which we could be proactive on in relation to, our hospitals, say like my own here at Newport or the Northeastern Regional Hospital in St. Johnsbury? And I'll listen for your response, sir. Thank you.
Well, you gave me a wide lane there. We have, I'm pretty proud of this state and the governor and all of you of how we've reacted to this crisis. We're in, and I don't want to claim victory, so don't misunderstand me, but we're in pretty darn good shape compared to a lot of other states that are surrounding us right now. Primarily because we acted early and we acted on our own. We expanded testing when the CDC wasn't recommending it. They were recommending only testing for people that were hospitalized. We said no. We said we're going to test for people that had symptoms, and frankly, we came very close to running out of test supplies at one point because we had that policy in place. When we needed more data, we tested more. We didn't stop testing. We tested more when we needed more data to make sure that we were on the right course in moving forward. We went out and got our own supplies. We went out and found tests and found testing capability. We ran an airplane from Burlington to Rochester, Minnesota to the Mayo Institute to get our tests on a daily basis. We did a lot by ourselves. And the fact is, we've expanded testing to the facilities that I talked about. In terms of Newport, if we strip out of our capacity out of Newport, like we did in St. Albans, there's a chance that we would move COVID positive patients if we had the space in St. Johnsbury as well. Like I said, if we get a case or cases like we did in St. Albans in a facility, we'll test the whole facility like we did. This is not a small undertaking, by the way, as well as the Veterans Home. I mean, these facilities are good size, and we test within 28 to 48 hours. We have a lot of people on the ground that are testing. So I'm holding my tongue a little bit on the federal response because we've done a lot by ourselves, and you all should be proud of what you've all done here, all pretty much by ourselves as we've moved forward.
We've done by ourselves together.
That's right.
I must say it's really critically important to keep lines of communication open between administration and legislature.
That's right.
Yeah.
When I met by ourselves, I meant all of us.
I understand. I completely understand. Representative Chena, it's your turn.
Thanks, Senator. So I have 3 questions I'm going to ask, and then Secretary, if you need to follow up later with answers, that's fine, but I'll put them out there now. One question has to do, you mentioned the different lanes. I'm even doing your hand motions, the different lanes, and one of them was the designated agencies and specialized service agencies. And in the last few years, the state has stepped up and tried to improve funding for designated agencies for the hard work we asked them to do, but we didn't do the same for the specialized service agencies. And so what I'm hearing from constituents and colleagues that they're having a even harder time keeping staff and recruiting staff now that there's more hazardous working conditions. And so one question would be, what can we do to improve funding for those agencies so that they not only can pay workers what they deserve equal to the designated agencies in the state, but also what kind of hazard pay or hazard benefits could they get? The second question has to do with how we're helping homeless people during the crisis. I know that in Burlington, there's a camp that's being used for people, and then also the hotel that you mentioned for COVID positive people who are experiencing homelessness. But my concern is, what are we going to do when the pandemic subsides about the people who are being housed in these temporary facilities? And this ties into the specialized service agency issue of what might we do after, so that we can end homelessness now that so many people are engaged in services to be safe during the crisis. And the last question is has to do with what's next. I'm also grateful for all the hard work that the state agencies have done to prepare for a surge, and it does seem like we're well positioned for a surge. But if we can prevent that surge, in order to maintain public health, we're going to need a long-term strategy. And we've been hearing a lot about what's working and not working around the world in terms of following up this phase with contact tracing and more testing and antibody testing. And I've heard you and others speak in press conferences. I'm one of the regular followers of your press conferences. So I've heard some of this before, but I'm wondering if you could speak a little more about what are your thoughts about the long-term plan, like not just the next 3 months, but like the next 12 to 18 months in terms of how the state can manage and control the spread of COVID-19. And also, I'm curious if there's any talk about coordinating with surrounding states. Like there's a pact of states in the Northeast trying to coordinate their efforts about reopening. And that seems like a wise strategy. So I'm just curious about that as well. Thank you.
Let me try to answer those one at a time. When I talk DAs, I talk SSAs as well. I mean, we are looking at how we're funding both entities, recognizing that they're both important and they have unique roles that we do have to recognize during this crisis. On homelessness, I got to tell you, we've spent enormous amounts of time to make sure that people are not going without a home at night. With COVID positive, obviously we have facilities. We talked about the Holiday Inn. For COVID negative, we have the North Letty Beach in terms of what's there. But we also have, opened up another hotel in Chittenden County for homeless that are not COVID positive. And our hotel voucher system has been robust, to say the least, as we move forward. As we talk about the sort of the next phase in this and the various testing that will be done, we've formed a task force in terms of the various testing that can be done, and there are various ways to test. That are different in terms of looking at the future and those with antibodies within their system and things like that. I gotta tell you, I've never known how much I use my hands, but the antibodies that are out there, but that's not for right now. But looking at the future in terms of contact tracing, we never gave up on contact tracing. Actually, we bolstered our contact tracing during this crisis, because we never gave up on confinement and confining this. Mitigation was all the things that the governor put in place. The shutting down in the school system, the stay home, stay safe, those sort of things are mitigation, but we never gave up on confinement. And you're starting to see that now with sort of our expansion with nursing homes and corrections and designated residential treatment facilities in terms of what's going on. As we get ready to even think about restarting, and I think that's the word that I would use, restarting our economy, it's not going to be flip a switch on, as the governor has talked about. It's going to be a turn here as we start doing it. And you know, if we can learn from those other states that are doing it, that's fine. I don't mind, you know, and I'm sure the governor doesn't mind collaborating, but we've been doing a pretty darn good job with what we're doing, and we should continue to do what we think is best for this state and how we can move forward on our restart. You know, we're again, SSAs we're looking out for, homeless, we've got to put a program in place, and we started to put the elements of those in place before this hit in terms of a long-term strategy for homelessness. And then third, we've got to move to other strategies, and I'm hoping that there's either a vaccine or I'm hoping for a vaccine and a test that will help us in those long-term strategies.
Thank you. Right. I guess one of my questions in terms of the second wave and the long-term strategy, I continue to come back to the need for therapeutic treatment or vaccination. We know that the vaccination is probably 12 to 18 months away, regardless of what anyone is saying. We also know that there are some really excellent clinical trials going on, including in this state, on some therapies, and I'm hoping that some of those will pan out. But as we look at turning things back on, I guess the question is, will the state continue to allow those workers who are among the vulnerable populations, will the state allow for those workers to continue to work remotely until we have some vaccine or some proven therapies?
Yeah, I think if you know, there's a lot of vulnerable people in that group. I mean, there are people that, for example, that are on cancer drugs that are vulnerable. There are other people. They're gonna continue to work remotely until we can figure out what is the solution here, because we are going to have a rebound. Unless we have a vaccine, we're going to have a rebound at some point in the future, whether it's next flu season or, you know, this acts like a flu. It's just more contagious and in some regards deadlier. So we're going to have to figure this out as we go forward.
Right. Thank you. Thank you for that. That is actually reassuring to a number of people who have contacted me with that question. Very helpful. So any other questions for Secretary Smith?
Could I just name a couple quick things and whether we
Sure.
hear responses now? And then one comment that I want to make sure I share. One is just for the committee and for the secretary to know that we are meeting tomorrow as a joint committee with representatives from the Department of Health around racial justice and equity issues, and that the collection of race data, which apparently wasn't happening early on, really does need to happen. And we'll be talking about that in some testimony tomorrow. I'm not sure. And a question that's been raised in our committee a number of times is directives and help for those dealing with remains for folks who have tested positive, and how to have workers stay safe as we have the unfortunate circumstance which we have of people passing on from COVID-19, and how to stay safe throughout the entire process of removal of bodies. It was shared with me, there is a protocol that I think Dale has issued, which I have not yet had a chance to share with our full committee, or perhaps with both of our committees. But I think there's still some remaining questions there. Again, I don't think we need to address it right now, but I think it is an issue that people are asking about, and I don't think there's particular awareness of.
Right.
And then last point I'd like to make before we finish is to acknowledge the significance of our payment reform efforts and how that has in fact been incredibly positive for sustaining our hospitals as well as our DAs and our folks who are working through payment reform, where monies in fact have been able to be put forward on a regular basis rather than on a fee for service, which has just dropped out from underneath us. And I think we need to be unabashed in acknowledging the important impact that many of these payment reform efforts have made during this type of emergency. So,
Yeah, Mr. Chair, I couldn't agree more than what you just said. I mean, the payment reform effort has allowed us the flexibility to do many of the things that we're doing right now. In terms of the remains, there has been guidance that has been put out by the medical examiner's office, and we'll share those and we'll see what we can do better in terms of going on from there. Thank you.
Thank you. Thank you for that. I want to reinforce what Representative Lippert has said about our payment reform and link that with the ACO and how critically important it is to maintain some cohesion and cohesiveness for that organization going through this emergency. And I encourage all of us on our two committees to be supportive voices for payment reform and for the ACO. I know that is sometimes difficult for some people, but it is we are ahead in so many ways of every other state that we need to recognize that and thank Secretary Smith for your persistence on this and others for the work that they're doing. So I think unless there are other questions or comments, we could all make comments all day. We're not going to allow that, but unless there are other questions, this has been great.
Great.
Thank you, Secretary Smith, and thank you for all the work that you are doing. It is very much appreciated. And I'm seeing the person on your left. We appreciate the work that your office is doing very much. So.
Thank you very much. I appreciate all the work you're doing as well. So
good.
We'll
we
get
gotta
together.
Keep it up.
Okay, thank you.
Okay.
All right, committees, I think that is it for the day. I know that a couple of the senators had to leave for another meeting. We will be meeting again tomorrow.
Tomorrow at 10:30. And
Yes.
again, I want to say, Senator Lyons, I think our work to do this jointly has proven to be very valuable and
Good.
efficient and effective. So I'm glad we've put the energy into doing that. And thank you to all the committee members who participated in a way that allows everyone to have a chance to participate. Because doing joint committee meetings between the House and Senate is often a work in progress, and I think we've been successful today. So thank you.
Very much so. And we'll be doing our agenda planning tomorrow for next week. So
As will we. As will we.
Good. All right.
Okay.
Thank
See you all tomorrow.
Good to
Take
see
care,
you.
everyone. Nellie, we're good to close down, or Julie or Demis. I don't know who's doing it, but there we are.
Okay.
All right, I am ending the live stream.
Thank you.